Now, as we're talking about suturing this quarter, I've mentioned numerous times, and I'm sure Dr. Krushwitz has as well, is we're playing with tissue. We're doing different techniques for closing the skin to minimize the scarring. And what tends to happen, I don't know if you notice here, but you can see there's a straight crease on this individual. And this is fairly noticeable on the actual skin of the pig. What we do tend to find, and this is because the human eye tends to see straight lines very, very readily. It preferentially selects for those. So if we could actually change the curvature of the line, make it a curve, or make it an S, or make it W, or something like this, many times you can actually decrease the cosmetic effect of the surgery and actually minimize the visibility of the actual scar in cosmetic areas like the face or upper chest or arms for that matter. So this method of curving the ellipse is allowing us to, one, to follow skin lines as they curve perhaps around a person's mouth or perhaps around their eyes or ears, something of this nature. But at the same time, it's allowing us to minimize the effect of the actual suturing itself. So let's say, for example, the skin lines on this pig typically go straight across here on the pig, as you can see. But let's say, for example, that the skin lines are curved on the pig for whatever reason. Let's say this is around the pig's mouth or something, or a person's mouth, and the skin lines are actually curved. And if we actually have a lesion on the skin, okay, I can actually cut this in a manner that's going to tend to give me a curved closure line rather than a straight closure line. Since the lines are curving on this side, I'm actually going to curve one side of my cut. So I'm going to basically cut on one side like such and curve it like this. See this curved on one side. I then cut straight across the other side. And again, I can support the skin as I need it. Okay. Coming across to the other side like such. So I've taken out a curve of skin or a hemisphere, so to speak, of the skin from this patient. Okay, and now as I go to close this up, depending upon how I actually close this up, I can accentuate to some degree. I'm going to lose some of this curvature, but you can see this side is curved and this is close to the skin lines. When I close this up, I can actually close this up in a manner that's going to tend to allow this curvature to remain as much as possible. And what I can do is if I'm fairly close to the curvature here, when I undermine, I'm going to keep this side without undermining this side, and just undermine on this side, which then will have the tendency of pulling this side more easily this direction and minimizing the pull downward, which would flatten the curve on this side. If the curvature here is too much and I want to flatten the whole thing, make it less of a curvature, I can undermine this side and minimize, or do not undermine on this side, then I can pull this side down to the other and flatten out, as you can see what's happening actually here. Okay, so we do have that variability. Again, you're playing with the tissue. The ideal scenario would be that this curvature matches the curvature of the patient, so that when they smile or something like this, there'll be a wrinkle line, and this will actually be embedded right in the wrinkle line. That's kind of what we're shooting for. Okay, so here, let's say, for example, we wish to kind of maintain this curvature as much as possible. So what I'm going to do is I'm not going to do any undermining on this side, but I'll undermine on this side so that this side will pull up more easily here and minimize the effect of flattening the curve. It's going to flatten the curve to some extent, but it will tend to minimize. At this point, the first stitch you put in is a critical stitch. Because if I pull the skin up and I pull off to an angle, you can see I'm developing a dog ear over there. If I pull to this side, I'm going to create another dog ear on this side. Or if I come across with this side, I can create dog ears on this side. So the first stitch on this one is critical. So you need to make sure you're right in the middle, you're lined up properly, and everything's going to appear pretty flat. So I kind of pull one side, and then I kind of put a little mark on the skin on the other side. So I know pretty much where I'm going to be putting my first stitch, and on both sides to tend to minimize. And then I go back, and before I tie this off, I'll actually go check to make sure that this is going to work out okay. So I'm going to go on this side over here, simple interrupted about 1/8 of an inch back from the edge, pull through, go across the other side, about 1/8 of an inch back from the edge again, remember, push through, like such, Okay, I then take the thread and pull the thread across to see how that's closing up. And you can see that's closing up real well. Okay, if I pull a different direction, pull this direction, notice I can create dog ears. Or if I pull to this side over here, I can create dog ears. So I want to make sure that when I pull directly across, that I'm intending to minimize the dog ears. Okay, so this is certainly within the range of us being able to close this up. Notice when I do pull this closed, you notice there's a little bit on this side over here and a little bit here, but that's not enough for us to worry about. But you can see if it was accentuated more, what would tend to happen would be that we would end up getting a much more pronounced dog ear. So this will work for us. It probably isn't perfect, but it should close certainly fine for us, and everything should be fine. So this first stitch, I'm going to pull it across, snug it up, okay? And again, now when I look at this, I am seeing a little bit of a pinch there, a little bit of a pinch here, but everything is going to come together. I can flatten everything out, and everything should come together very nicely. Or what I could do is just take that stitch out completely and change my position again. So let's go ahead and pull the stitch out. Let's change my position just slightly, and we'll see what we can do with that. So I'm going to come a little bit more here, pop through the side over here. Okay, going to basically go over just a snitch, pop through, and it's just by looking at this now I can see that I'm going to have a dog ear here. So let's back this up, move this over a little bit more this direction. Notice I can kind of play with this a little bit, pop this through. Okay, see how this is going to close out. I think this is going to close out pretty well here. So pull through, close it up again, and that's going to close up real nice. Okay, so the first stitch. But you're noticing I'm playing with my actual positioning on one side versus the other to making sure that this first stitch is going to hold up real well. Now, when I make my actual curve on one side, I'm not making it, you notice I didn't make a half of a circle. I'm making kind of like half of an ellipse. So that when I go ahead and close this up again, this should close up very nicely. You can see it's going to close up very nicely. If I make a big position like this, this is going to close up. I'm going to end up with dog ears, significant dog ears in this regard. So what I do is I basically consider this as 1/2 of a 3:1 length to width ratio ellipse, and I close up. So I'd go ahead and put simple interrupters, 2 simple interrupters probably on each side to finish closing this up. And this is the curving of the ellipse.